Or yeah.
Just one
Hello,
minute.
everyone. Greetings, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart all the times is a quest of humans, right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is a common skin condition that can impact anyone, whether you are a teenager or an adult. The skin complaint is no stranger. Knowing the various types of acne can help you treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just a skin ailment to various psychological disorders such as depression, anxiety, stress, and low self confidence. Hence, it is important to know about the holistic treatment approach for this ailment. Despite its prevalence, few people know that June is Acne Awareness Month. Acne Awareness Month was launched to combat the negative stigma surrounding this common skin condition, also to be aware of treatment approach for acne management. So let's connect today with our skin expert, Dr. Deepthi Ravi, live from Chennai to talk on acne management. Dr. Deepthi Ravi, a highly skilled cosmetic dermatologist based in Chennai, boasts a commendable 12 years of experience in her respective fields. Operating from her practice, Dr. Deepthi's Derma Clinic is in T Nagar, Chennai. She is dedicated to delivering exceptional care to her patients. Her academic credentials include an MBBS from RCSM Government Medical College, Kolhapur, MD in Dermatology, Venereology and Leprosy from Kasturba Medical College, Manipal, and MRCPS from the Royal College of Physicians and Surgeons, Glasgow, in 2017. In addition to providing a spectrum of services related to skin and hair, Dr. Deepthi Ravi excels in anti-aging interventions, including fillers, Botox, threads. Furthermore, her extensive proficiency extends to a wide range of treatments encompassing peels, Q-switched laser procedures, PRP therapy, acne and acne scar reductions, hair care treatments, mesotherapy, microneedling, radiofrequency, derma roller, and more, showcasing her diverse and comprehensive expertise in dermatological care. Thank you, Doctor, for joining us today. It is our pleasure to host you. Doctor, our first question for you would be, please start with what is acne and what are the types of acne lesion?
So acne is basically an inflammation of the pilus. Thank you, Priyanjali, for the wonderful introduction and
Right, right,
talking
right,
about
Doctor.
it. And thank you to Beautiful Spotless Skin and for hosting me. So acne is basically an inflammation of the pilosebaceous gland. So you have hair follicles all over the body. But over the face, you have these really tiny hair follicles, but these are connected to larger sebaceous glands with larger lobules. So these produce sebum, which keeps your skin smooth, prevents excessive dryness. But sometimes what happens is due to excessive sebum production, these glands get blocked sometimes. So due to excessive keratinization, excessive sebum production, it gets blocked. And when it gets blocked, you get these comedones, which are blackheads and whiteheads. So blackheads are the open comedones. When these sebum is exposed to the atmosphere, it gets oxidized to form a black plug. And then whiteheads are these covered comedones, which just look like tiny white. You feel it more than seeing it. And then when the blockade continues, when something is there which is not supposed to be there, it causes a lot more inflammation, and then leads to papule formation, which and sometimes it can lead to secondary infection, leading to pustule formation, and then it leads to sometimes when the inflammation goes a bit under the skin, you see cysts and nodule formation, which are a bit more painful. And these kind of lesions lead to more of scarring. So the four things which basically cause acne is the excessive sebum production, excessive keratinization leading to blockade of the skin, secondary infection, and also these nodule formation and cyst formation, which in turn leads to more of scarring due to secretion of matrix metalloproteinases in certain people, which then causes this kind of scarring. So the treatment will also be to combat each one of these
Right.
pathophysiological methods.
Right, doctor. So, does specific area of face acne mean specific causes?
Yeah, generally, what you see is when there's a lot more of hormonal disturbance, you see a U pattern of acne. It's mostly there in the jawline. It's especially seen in women with PCOD, or even in cases of insulin resistance. You see acne predominance over the U pattern, especially over the jawline. And when you have excessive dandruff, or if they're using a lot of hair cosmetics, or if they have hairstyles which tend to impinge on the forehead, then you see more of like forehead acne. And when there's excess sebum production, which is basically hyposeborrhea, then you see acne mainly in the T zone, which is exactly in this forehead area and the cheek area and the nose area. And so sometimes you also see acne, mechanical acne, which is due to friction when they're not replacing their pillowcases or they have a habit of sitting there. That is where it is concentrated over the cheeks. But in a proper case of acne vulgaris or the full blown acne, then you do see acne everywhere over the face, body, chest, and back. And you also see a lot of truncal acne, and especially people, I mean, who sweat a lot and don't take a shower immediately after sweating, then you see a bit of truncal acne also.
Right. Doctor, what are the grades of acne?
There are basically four grades of acne. In grade one, you typically see only the blackheads and whiteheads, and you do see a bit of papular lesions also. And then in grade two, you see more of lot of papular lesions. The initial lesions will also be there, along with a bit of pustules. And in grade three, you see the comedones, papules, pustules, a lot of pustules, along with a few nodules and cysts also. In the fourth grade, which is the most severe, then you see a lot of cystic lesions and a lot of nodules. And this is the one which leaves a lot of scarring.
Right. So, doctor, what do we usually suggest the patients? Like, while it is the grade one, which people take very casually, like it can be treated at home or a little bit of self-care, maybe the solution of it. So,
Mhm.
what do we usually suggest the patients who come during the second, like the second grade or the third grade? What do we usually suggest them?
So for the second or third grade, they need to use a regimen. What people have to remember is acne is a process of control. It cannot be cured. As in, like right now, because the puberty age is also gone down, people do get
Right.
acne right from 7 to 8 years of age, and it does extend beyond. Previously, it was like from 13 years of age to about 35, 36 years of age. But now it's, I mean, I'm seeing patients who are getting acne at a very young age also, like 7 to 8 years of age, right up to the ages of, 50 or even 60 years of age. So what we have to remember is, even because I also get acne quite often, it is a proper, you have to follow a regimen and keep acne under control. There's no cure as in, because people have this complaint often that they take treatment and then it comes down, but it comes back again. And that is the method by which it works. If you have a tendency of getting acne, if it's a one-off incident where you're getting it due to cosmetics, or you're getting it due to some specific reason, like that period you're getting acne, then it goes. But if you generally have a condition of acne vulgaris, it tends to persist. So people do believe that it does go on its own also, but it tends to leave a lot of scarring and pigmentation. So typically for the first grade of acne, only topicals would suffice. But they do need, for the second and third grade of acne, you do need to supplement topicals with oral medications prescribed by a dermatologist. But you also have to use a regimen, a face wash with salicylic acid or glycolic acid, a sunscreen, because most of the anti-acne products will cause a bit of sun sensitivity. And typically, we give, if there's a lot of pustules, we give oral antibiotics as well. And sometimes we do use topical antibiotics. And at night, we give an adapalene with a benzyl peroxide based combination, or even, there's a stronger retinoid, trifurutine also available. So we do that along with chemical peels. And if to bring down acne a bit faster. And so a regimen is very important in acne, which is prescribed by a dermatologist. And often people think that moisturizers are not necessary in acne because it's already an oily condition. But when you have to tolerate retinoids for a long period of time, because you will have to use retinoids for a longer period of time, then the tolerance of the medication is very important, because otherwise if you get a lot of irritation, people generally stop with the treatment. So in that case, when you use moisturizers, the tolerance of the treatment increases, and then your accept and what happens is when your skin barrier also gets defect in acne, along with retinoids, which also disrupts your skin barrier. So moisturizing is also very important.
Right. So we are saying that it can be controlled, but
Hmm.
it can't be cured. That's what
It
you're
can
saying.
be controlled, and the current, if you get a breakout of acne, that can be cured. But it's not like you'll never get a new acne lesion in the future. So if you maintain
Mhm.
a regimen, the chances of you getting new acne lesions will be reduced. But you will, I mean, if you have an acne prone skin, you might get a breakout sometime in the future. It's not like the breakouts can be totally prevented. It can be, the chances of breakouts can be reduced when you use a regimen. But the current episode, whatever you're having, that can be, controlled, and that can be cured.
Right. Doctor, what are the treatment options for different grades of acne?
So for typically, as I said, for the first grade, grade 1 of acne, we generally prefer topical medications. So we
Mhm.
go for a salicylic acid based face wash. We use topical retinoids because that is quite enough to, reduce the comedones. And when and along with sunscreen, face wash, and moisturizer. I mean, all this is quite mandatory, sunscreen and moisturizer. And for grade 2, when we see a lot of more papular lesions, red lesions, which are inflamed, then we prefer an anti-inflammatory agent also, like benzoyl peroxide, along with your retinoids. And and then this is the stage where we can also do peels. In grade 1, we can do peels to reduce the keratinization, to remove the dead skin layer, so to also reduce the blockade. But we can also do comedone extraction in the first stage. When we move on to the grade 2 and 3, we can go for slightly stronger peels, and we can also combine the retinoids with anti-inflammatory medications also, and then we can start on oral antibiotics and topical antibiotics also, topical antibiotics for a very short period of time to prevent resistance. And as we move on to the grade 3 and grade 4, we might need to start oral retinoids also, which is only a prescription medicine. It cannot be taken by the patient themselves. And then we can, in case there's very severe acne and severe scarring, and then we can do a CO2 laser also, even in active acne lesions, to reduce the inflammation. Energy-based devices can be done in that point also. And we can also do intralesional injections in very severe nodulocystic acne to bring down the inflammation.
Right. Doctor, as we're talking about the medications, can you please tell us what can one do when he or she has a sensitive skin and he or she is suffering from acne at the same point?
So in case of sensitive skin, the patient does feel the skin feels stretched out, and they feel very irritated, and anything applied on the skin might cause burning. So the sensitivity might be caused by the patient themselves when they're using too many products, because obviously if they have acne, they tend to use a lot of products by themselves, and they overlap products, and this might cause the skin to be sensitive. And certain patients do have sensitive skin by themselves. So in case of sensitive skin, we can't start all products at once as we do in normal cases of acne, because we have to start products one by one, and we'll prefer to start with milder products. We prefer to start with a topical antibiotic. I prefer to give more of oral medications in patients with sensitive skin to bring down the irritation first, so that they don't topically they don't feel too much of burning. And a soothing regimen is very important in patients with sensitive skin. So for them, even more than normal patients of acne, a sunscreen and a moisturizer and a milder face wash is very important. And especially night medications, when retinoids are used, a short contact therapy is very necessary, because they can't keep it overnight like other patients of acne. Even in normal patients of acne, we do test it for a short period of time before asking them to keep it overnight. But especially patients with sensitive skin, they have to use a short contact therapy. They can start with half an hour and go for 1 or 2 hours. And then, as they are able to tolerate it, they can keep it on overnight. And initially, I don't start with the really stronger medications like 0.3% adapalene. I go with the milder versions and more nanoparticle versions of the medications and then move on to the stronger medications. And any point of time, if they feel irritation, they have to stop the medicine for a few days and then restart it. Meanwhile, we'll be controlling with the oral medications as well. And peels also will do a sensitivity test for them. We'll do it in everyone, but for them, we'll have to be a bit more careful and start with a bit of milder peels and then go ahead.
Right. Doctor, we also know that diet plays a very important role in acne. Is there any scientific reason behind it? And what kind of diet should one, follow, or what can worsen the effect of acne?
So dye effect I've seen more with, with causing pigmentation. I've not seen too much of dyes worsening acne, probably because the age group is also different. Younger patients don't use much of dye. Acne is seen mostly in the younger age groups. So I've seen
Right.
more of pigmentation associated with dye. As far as dye is concerned, it's better to go for PPD-free dyes, and most of the black pigment comes from PPD only, so they can look for other alternatives. And always using they can test a small area and then use it. And asking someone else to apply so that it doesn't come in contact with the face, and applying a thin layer of Vaseline, not on the face because then it might lead to acne, like at the border of the hairline. And all that might also help. But generally, I've not seen an overlap between dye usage and acne personally.
Does stress has anything to do with acne, doctor?
Yeah, definitely. Stress also causes increase in insulin-like growth factor, and also it does trigger acne, and you do see more of acne, more of seborrhea, and also patients with stress. So definitely reducing stress, especially you do see an aggravation of acne during exam times and with late nights, and when then there's more cortisol secretion, and then that definitely triggers acne. And acne itself causes stress, so then it becomes a cycle, and then.
Right, right. Well, with time, we are getting to see this that stress has got to do a lot with most of the
Skin
physicalities
issues.
or physical problems which we are
Correct.
facing. Uh, and as doctor mentioned today, stress again has got a very, very close relation with acne. So again, coming back to the point, doctor, what is the ideal skincare routine to control acne? Which one should follow?
So, in a patient with acne prone skin, depending on how the sensitivity of the skin, it's always important to use at least once a day to use a salicylic acid based face wash so that the
Mhm.
oiliness comes down. And then always use, you're talking about the general regimen or the treatment part of it?
No, just the normal skincare
Well,
routine which
and
everyone should follow in order to avoid
so
acne.
so it's important to remove makeup first of all. If people are applying makeup, to remove it at night, and also in an acne-prone skin, it's also very important to not apply too much of like oily based makeup, too much of oil and oily foundation. And in any case, skin type, it's important to use a sunscreen because when you have acne, also then the post-acne pigmentation and the erythema worsens when you don't use a sunscreen. And sometimes
Right.
sunlight itself triggers a bit of acne. So maintain as much sun protection as possible. Use a sunscreen morning and afternoon. And in case you're going out too much in the sun, then reapply it every 2 to 3 hours. And also in patients with acne, it's important to use a non-comedogenic sunscreen, which has a matte finish so that they don't feel too much oily. And if possible, they can go for gel-based sunscreens also. And and then they need to use a face wash. If it's very sensitive, they can use a slightly milder face wash. But otherwise, it's better to use a salicylic acid based face wash at least once. If it's too oily, they can use benzyl peroxide based face washes also. And as moisturizer is very important in acne because as I said, it's a long term treatment, and they'll have to use some retinoids as a maintenance also. So especially the tolerance of the retinoids reduces if they don't use a moisturizer. So studies have shown that when people use moisturizers and sunscreens, the tolerance of the medication increases and they're able to continue it for a longer period of time, thereby keeping their acne also at bay. And most importantly, if they're going anywhere dusty or there's a lot of dust accumulation on the skin, it's important to wash your face after coming back. And especially for truncal acne, it's important to take a bath after. Exercise also helps with acne reduction by reducing insulin resistance and increase in endorphins and all that. But still, when that is a positive effect of exercise, but the negative effect is people end up with more truncal acne. So it's important to take a shower immediately after, and especially in a tropical climate like Chennai, it's important to wear loose cotton clothing and so not cause too much of occlusion, especially of the trunk, to prevent acne lesions. And also, it's important for them not to pick the lesions because it'll tend to leave scarring.
Right. Doctor, because you mentioned about makeup,
Mhm.
so do we suggest makeup for acne patients as well?
We
Can they
don't.
use it?
We tell them not to use too much of makeup, especially liquid-based foundations. But they can use a primer, and they can use. See, their acne always leaves behind pigmentation, so they can use a concealer on those spots alone. So because eventually sun exposure to that area also decreases, and then the further pigmentation will reduce, and they can go for powder based formulations of makeup instead of liquid based or oily based formulations of makeup. So they can use makeup, but they will have to remove it before, because to prevent occlusion and cause further.
Doctor, what can be the do's and don'ts in acne? Like for the one who has acne.
Mainly for them, it's important for them to maintain a proper lifestyle, to reduce intake of too much of sweets, chocolates, dairy products, because that in turn increases insulin-like growth factor, and also too much of sugar causes sugar spikes, causes increased inflammation in the body, and that in turn tends to trigger more of acne. And also, it's for them to maintain a good sleep-wake cycle. Also, try to sleep early, get up early to reduce the amount of cortisol in the blood stream, and also to reduce stress related to acne and not to pick lesions too much. And one more thing very important now is not to use too many products, because they see everything, like a lot of influencers promoting everything, so they tend to use everything at gaps of. I've had patients who are using everything at gaps of 2 hours. They end up with so much of irritation. And
Right.
so that, and also topical steroid based creams also, they don't know that it has steroid and tend to use it for a longer period of time, and sometimes that in turn damages the skin permanently. Yes.
Right. Also, there are many dupes, moving around in the market nowadays. All the brands, or they have a
Mm,
first copy or a second copy
mm,
or a third copy, and
mm,
people tend to fall for those traps because
mm.
those are attractive. The sale, the offers which they give are attractive. So how can those be, harmful to our skin? Those products be harmful to our skin?
So if as because I think most of the medications dermatologists prescribed are available in pharmacies generally. So I don't think it will be a problem with these preparations as such. Because online, I don't know. I mean, generally, unless it's a trusted site, I think it's better not to get. Some medications are available OTC. So it's
Right.
better not to get. If you're talking about other cosmetological products, I think they should only verify the where they're getting it from and if it's the real product, because sometimes they might be just something like, which might aggravate the condition, and so for them it.
Right. Doctor, also please tell us what can be the complications which are related to acne for the people who are watching us right now, who are maybe in the first stage, or maybe they have a tendency of having acne. For those people, please let us know what can be the complications related to acne as well.
So acne, the most dreaded complication is obviously scarring. So which can be atrophic scarring most commonly, or hypertrophic scarring. So that's why it's important to treat acne in the earlier stages to prevent the scarring from happening. And some people tend to scar a bit more because their skin type is such that they tend to scar a bit more. And for preventing scarring, it's important to treat acne in the earlier stages, and also to prevent, I mean, they shouldn't pick the lesions, because that kind of pressure causes more of scarring. And second thing is obviously post acne pigmentation, which is not so severe because it can be treated and it does go with time also. So those are the major things. And sometimes when acne is really severe, it tends to cause a lot of infection and inflammation. In those cases, it's important to immediately treat it again to prevent the post-acne sequelae.
Right. Doctor, also just a generic question. Like many times before going for an important event, we see an acne appearing. So,
Mm.
is there any solution which can be, given in a very
Yeah,
short
so
time, maybe?
if it's like
Yeah,
1 or
immediate
2
result.
days, yeah, correct. This happens a lot because of the stress of the event as well. So if it's 1 or 2 days before the injection, intralesional injections can be given, and 1 or 2 days before the function. So that will flatten the lesion off. And if it's a week or so before the function, then we can even do a peel. So it'll dry out the lesions a bit, and if necessary, we can do intralesional starts in certain areas. And there's a laser specific for acne lesions also now. So these are certain options which can be done if it tends to crop up just before an event.
Right. Well, I can see a few questions coming up from the viewers. We have Aditi Srivastava asking us, can you please suggest me some home remedies for curing acne?
So home remedies, it's better to eat rather than apply, I believe. Like take a lot of fruits and vegetables, take a lot of fluids, and avoid too much of, the same junk food, chocolates, high food, high glycemic index. So that is better. Topically applying anything might lead to irritation. So, and might cause more damage to the skin. It's always better to use medicated preparations if you have a case of it. Maybe first grade of acne, you can just go for a salicylic acid-based face wash, try to see if it tends to come down. But in the higher grades, it's always better to get it treated as such instead of going it for home.
Right. Doctor, our next question comes from Ajit, who asks, is there a correlation between dairy consumption and acne?
Yeah, there are studies which are showing milk consumption increases the incidence of acne. And even if it's skim milk, they add whey protein to it, which in turn causes more of that. So, decreasing dairy consumption, not eliminating it, will definitely decrease
Right.
it.
Right. Well, with that, Ajit, I think that was a yes for your question. We can, as doctor mentioned, that there are few traces of a correlation being between dairy consumption and acne. We move on with the next question, doctor, which comes from Ahana. She asks, what are the potential psychological effect of acne and how can they be addressed?
So people, especially in the teenage group, they do go in for depression because of acne lesions, even if the acne is minor. So I think in that case, counseling is very important by the dermatologists themselves. But otherwise, it can be, they can psychodermatology counseling can also be done. And also, most often, if the acne comes down, they also feel better. So that way also it improves. So
Right.
unless it's very severe forms of acne which leaves very severe scarring, then it needs treatment over a period of years. So
Well, the next question comes from Minal, who asks, what are some effective skincare routines for reducing acne?
basically the thing is same. So cleansing with a salicylic acid based face wash or a benzyl peroxide face wash, and following a routine like cleansing your face 2 to 3 times a day using sunscreen, and using a mild moisturizer, a gel based moisturizer, and something with anti-irritant properties to reduce the side effects of topical retinoids. These generally help in at least maintaining acne and pain to a certain extent.
Right. Right. So
And
basically, right. Yes,
and
doctor.
some people do require topical retinoids over a longer period of time, also, including myself. So, in that case, your skin does get irritated over a period of time. So, then when you're using all this, that irritation tends to come down.
Right. And as we always say, that self medication is something we never choose. And we do not want you to choose as well. We have our experts around you all the time. So make sure you go and get your solution from your expert. Before we take a leave, doctor, Any closing remarks for our viewers who are watching us right now?
So they have to remember that, especially the common acne vulgaris is a process of maintenance. They'll have to maintain it over a long period of time, and acne is treatable. I mean, some people feel that it is a phase which will just go off, but in those cases, it tends to leave a lot of scarring. So it's always better to get acne treated at the earliest to prevent post acne scarring, and also it is a condition which can be controlled, and it's I mean, as you said, more than 80% of the population face it at some point of time or the other. So it helps if they can follow a routine and are consistent with the routine and can get regular follow-ups. So in that case, it can be pretty much kept under control.
Right. And as we always say, consistency the key to
Yeah.
success. Well, that was Dr. Dipthi for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers, and it was great to hear from you. We look forward to many more such sessions in the coming future. And to all the viewers who are watching us, thank you so much for your excellent participation for today's session. Stay connected to our beautiful Spotless Skin page. Thank you so much. Stay safe, stay healthy, and keep